Hello. I have not done a video like this before. So I am getting a partial knee replacement on my left knee, the lateral portion or the outside portion of my knee, tomorrow. And I wanted to document my progress through the entire process and hopefully help some people out there who are going through something similar. I know a lot of people um, want to know, as a doctor, what I go through, kind of things that I do for myself if I have to have surgery. Um, my background is physical medicine and rehabilitation, or sports medicine and pain management. And I have gone through a lot of surgeries. So this will be my seventh orthopedic surgery. So I can understand a lot of what my patients go through because I've gone through a lot of different surgeries. I've had shoulder surgery, I've had elbow surgeries. This will be the fourth surgery on this left knee here. I figure it'd be good to share some of my experiences, how I'm going to go through it. Hopefully to give some direction and guidance for some people going through something similar. Some people might be asking, why I'm going to have a partial knee replacement. Why don't I do something else, physical therapy, other types of injections like stem cells? And I have. Um, I so this injury occurred in my knee a few years ago. It's during judo, and I had a good fall on my the outside of my knee, and it tore the meniscus. Luckily, it didn't tear my lateral collateral ligament or my ACL, and so those were intact, but it tore my meniscus. Um, I did physical therapy afterwards. I also did a platelet-rich plasma or PRP injection, which normally does help torn meniscus. I've done that for my right knee and it seemed to do well, but it didn't seem to help the meniscus. It kept locking, and I had a hard time going down the stairs, which is the hardest thing. So I went and talked with a friend that I knew who's an orthopedic surgeon, and decided to have what's called a partial meniscectomy at that time. Um, the physician went through and said that the tear was pretty deep, went down to the bone, and he had to cut out a large chunk of my meniscus. So, for those of you who don't know what a meniscus is the rigid cartilage that is the cushion between the tibia and the fibula. I'm sorry, the tibia and the femur, and provides it provides that cushion when you are walking or running or any kind of impact activity. So it protects the cartilage, which surrounds the edges of the bone, but it's just this thick, rigid, sort of like a cartilage tissue in between the knees. So that had started to wear down. And after I had the partial meniscectomy, um, which is something that if you're thinking about getting one done, think really heavily about that, because depending on the severity, they may need to cut away a lot of it. Once it's gone, then it progresses towards arthritis. And arthritis can what arthritis is the inflammation of the bone when that space is gone or is too thin, and the bone starts to hit itself. It can cause some kind of inflammation, and because of that, that can cause a lot of pain. So I started to get more pain. So a couple of years ago, and I did physical therapy. I did uh, fat stem cells, obviously my own, and bone marrow stem cells twice. I also did um, what is it? Amniotic amniotic fluid. I did umbilical stem cells. I mean, I've done a lot of injections for this knee. And I think the main issue was that there wasn't any space there, so it has started to collapse. So the space has started to collapse. So even though I was injecting things in there that should help it to heal, because there wasn't any space, because the meniscus was gone, there's no more spacer there. It just started to collapse. My knee started to become what's called valgus, where it just started to cave in a little bit on that one side because there's no space. So in order to fill out that space, a couple of years ago, I found a physician. His name is Dr. Stone here in San Francisco, which is where I am right now. He did what's called an orthobiologic procedure. And what that is that he's an orthopedic surgeon, specializes in some of these alternative approaches, and he used a cadaver meniscus to replace the one that I had lost. And it worked pretty well for about 6 months. But I think my muscles had become so accustomed to that kind of slanted valgus knee positioning that it just ground away that that knee, that meniscus. So it's been 2 years, almost exactly, and that meniscus is ground down. My arthritis has returned, so I am getting a partial knee replacement. So what a partial knee replacement is different than a total knee replacement. A total knee replacement involves removing the edge, the femur and the tibia as they come together. You're going to chop off that ridge of the first one and the femur, and you also take out the ligaments as well. So your ACL gets ripped out, and it's replaced with artificial ligaments. So since I haven't torn my ACL or LCL, MCL, those are all still intact, I'm going to do what's called a partial knee replacement. And what that means is a less invasive procedure, and the knee is separated into 3 compartments. Your lateral or outside medial is the inside, and then the anterior, which is like underneath the kneecap. So we're just going to address the lateral aspect. And what that means is I had a CAT scan yesterday, and to image like a 3-dimensional image of the bone of my knee, and it's going to go into a robot, and the robot is going to give direction on what parts of the bone should be removed, so I can remove the least amount of bone, which is what I want, and preserve the ligaments. And so they're just going to take away, shave off the femur component and the tibia component, replace that with titanium, and then put a piece of polyurethane as an artificial meniscus in between. With the way that, because it's done by robot guidance and computer, it can actually also help to realign my knees, so it can help to remove that valgus, or that component where my knee is sort of caving in on one side and smashing that in. So that'll help to realign it, and then the rest is going to be physical therapy and strengthening up the muscles to make it aligned. The reason why partial knee is good for me is that I get to preserve my ligaments. I'm going to have full range of motion, much faster. The surgery is also less invasive because they're only taking out a small portion, taking out way less bone. My recovery hopefully will be faster, and I'm going to document that. So, but according to physical therapists who I just talked to, if I stick to their guidelines, in about 3 months, should be full functioning and full range of motion, and actually have this strength back as well. So it's a 3-month post-operative course. I hope that everything is going to go smoothly with that. And I'm going to document how the exercises are going. Hopefully that swelling and healing is getting better. So that's what's happening. I'm a little bit nervous, to be honest. I've gone through 9 surgeries. I've never had a piece of titanium put in there. Most of the time it's been arthroscopic surgeries where they stick something in there, scope it out, and like cleaning off bone spurs, all that stuff. I did have something pretty invasive with my shoulder because I had torn a ligament there and they had to reattach it. But I've never had anything that has literally replaced the bone inside my knee. So I am a little bit nervous, but felt pretty good about it. Been praying a ton, and I've actually felt good from my prayers. So I know some of you are also wondering, some of you may be wondering what kind of medications and supplements I'm taking. I was prescribed narcotics. I'm not very good with narcotics, meaning that they don't make me feel very good. I have like a very poor, my body just doesn't process it very well. So I get very nauseous. So I'm going to take some anti-nausea medication afterwards, and probably only take the narcotics at night to help me sleep for pain. I've got an ice machine as well. I'm going to strap on my knee to help with the swelling. I'm going to take some, probably my main pain medication is going to be Tylenol. I'm going to be taking also some Ketorolac or Toradol, which is a strong anti-inflammatory for about a week or so. And I'm going to be taking some baby aspirin as a blood thinner to prevent blood clots. So that's going to be a big thing. I have some supplements here. Obviously for me, I'm a big supplement guy. Food wise, I mean, I bought a whole bunch of things that are high in protein, have shakes, and Sunfit Protein Plus is Sunrider shakes, super high in protein. So protein is going to be a big thing for me to try and help build back the muscle, along with exercise. There's some important supplements I'm going to be taking too. One of them is going to be spirulina. Spirulina is pretty well known to be a strong, it's like one of those superfoods. It's a kind of blue-green algae, and if you look at it, it smells like fish, but it is also, because it's a unique kind of antioxidant, has a strong anti-inflammatory component. I've been taking 2 to 3 of these twice a day, and it's actually helped my other joints decrease in swelling. I have some elbow issues, and it's definitely helped with that. So I'm going to be continuing with that. I'm going to be taking 2 of those twice a day, maybe 3 twice a day. I'm going to be taking this MetaBooster. MetaBooster is collection of amino acids, L-arginine, acetyl L-carnitine, alpha lipoic acid, lysine. These are really good to help boost energy. I take these, like 3 of these every morning, to give me just mental focus, energy, but I'll probably need that for exercise. And also right after surgery, I'm really mentally loopy. Fortunately, I'm not very good. I mean, fortunately or unfortunately, I have a very poor tolerance for any medications, so I get very loopy. So something to help clear my mind really fast. So I'm going to take that along with our Top Focus Sunrider product as well. This is our nootropic stack. It's got L-alpha GPC, was it tooth club moss extract, or Hypersia serrata, which is really good. This is mainly to help boost that acetylcholine in your brain, so that you can help form memories better, which is going to be super foggy. I'm just not good with medications. So anyways, I'm going to be taking that. to really try to clarify my mind right after surgery, especially. These are ones that I always take. Conco, which is herbal formula to help with respiratory strength, and then Alpha 20C, which is another herbal formula to help boost my immune system right after surgery or all the time. I just think that that's important. It's boosting the immune system. Obviously, vitamin D3, do about 5,000 IUs a day, so that's going to be really important. So you can do that. I know that I usually talk about Sunrider supplements, so this is one really important one for me. Viros. So Viros is a collection of specific herbs that really support your testosterone. Has some herbs that have some function like testosterone, and for me, that's going to be really important. I've had, like I said, this be my 7th surgery, and I've tried surgeries without it, and my recovery is just slower. And with recovery, the wounds heal faster, my strength returns faster. So, and that's testosterone is important. I'm in my 40s, so that's definitely something up there. Another testosterone support, this is not a Sunrider product, but well-studied, Tongkat Ali. I like this brand here, NutriCost. And I take one of these twice a day, morning and night, along with my Viros. And this is a good supplement that helps to also release my testosterone. Your testosterone is usually bound with other molecules inside your body, and so this will help release it. So again, more testosterone to help with muscle recovery, help muscle strength. Like I said, a lot of this is going to be physical therapy and healing, and I need that. I would like to return to training in Brazilian Jiu-Jitsu, training judo, doing takedowns, doing some wrestling, and running. And these are all things that that hopefully I'll be able to get back to. The reason why I'm here with Dr. Stone is that he's a very focused on returning back to function. He works with a lot of athletes, and this is something that I want to get back to. I'm an athletic. I like to do physical things. He has done partial knee replacements on ultra marathon runners that have gone back to running ultra marathons, which is amazing, or downhill skiers. And I haven't been able to ski for years because so much pain in my knee. And there was an instructor, she was a downhill ski instructor, and she was able to go back to it after the partial knee replacement. Now there's risk that after my partial knee on the lateral aspect may still get breakdown of the medial aspect. And if that's the case, then I'll probably go and have a medial partial knee replacement, have the medial component removed and replaced. So of course, I'm going to try natural things. I'm going to try injections. But if it gets to that point, then I'll just do that. And the reason why I want to go in that route is that I want to maintain as much function, as much of my original tissue as I can, try not to cut away too much of my bone or my ligaments. And that's that's what a partial knee can do. So I'm also diet is going to be important. So doing Metashaper, VitaTaste, and Action Caps Fit. So Action Caps Fit promotes brown fat, which is helps to burn your fat away. And I don't want to get fat. Well, especially while I'm just sitting around. I'm going to be doing exercises, but I'm not going to be burning as many calories as I'm accustomed to. So in this VitaTaste will help block some of the absorption of sugar in my food, along with Metashaper, just concentrated resveratrol, helps to decrease the absorption of calories in general, keep my blood sugar low. So I don't hopefully you don't gain too much weight. I did gain some weight after the last surgery, so I'm gonna try and be mindful of that, and try and stay as fit and active as I can. It's 3 months, and I'm gonna plow through it. So I'm gonna be doing a lot of exercises. Probably gonna do some acupuncture again. I'm an acupuncturist, and also where I work, there's an acupuncturist there, and hopefully he can help me out. I'm going to use this red light therapy, help take down some of the inflammation. Anyways, as you can see, I've got a lot of stuff, and I research, try to keep as much of my healing as natural as possible, but I'm definitely open to obviously getting surgery when my body is unable to get to that point. Surgery sometimes is necessary. I'm open to all kinds of stuff though. So and anyways, just thought I'd give everybody an update. Sure, it'll go around that I'm getting surgery since I'm going to be out of work for a little bit of time. So and if you have any questions regarding this procedure, supplements I'm taking, you can leave it in the comments below. I will try and respond to as many comments as I can. And I hope that everybody's doing well. Hopefully this will give some help to some people maybe going through something similar. Pretty familiar with most joint issues. So if you have any questions about that, I'll do my best to respond to that as well. So hope I'll see you guys soon. I'm going to be posting probably every few days, maybe almost or every week on my progress, and we'll be excited. So I'm going to be excited to be able to walk and run again. I mean, heck, I haven't been able to run or walk long distances more than maybe a few blocks for years. And that's crazy to me. I really want to run. This sounds, things that you take for granted. I remember when I was in middle school, I hated running. I hated it. I remember my middle school gym teacher would make us run, and we had like this 2-mile run that we needed to do, and I hated it. And now, if I could run in like, I don't know, a quarter mile, it would be great. If I could, I can't sprint. I mean, I could do a really light jog, but I'd be really regretting it. But if I couldn't run, if there was a dog chasing me, I would not be able to run away from it. Just don't have the strength in my knee to be able to do that. And I mean, little things that I take for granted. My kids are doing martial arts classes, and I want to be able to coach them. My daughter is doing judo, and I mean, I've been doing judo for 23 years, and I would like to be able to do more of that, be able to help with that. So that's the goal. And hopefully you guys will enjoy the journey with me. All right. See you later.